Hello and welcome to my YouTube channel, AnatomyMentor. Today I'll be discussing the very important human organ, which is the spleen, which is present within our abdominal cavity. So today's topic for discussion is the gross anatomy of the spleen. So our learning objectives for today's topic are that we shall discuss today the location, surfaces, relations, blood supply, nerve supply, and lymphatic drainage of the spleen. We'll also talk about the splenomegaly and justify the direction of splenomegaly with anatomical knowledge of its ligaments. Also, we're going to justify the possibility of splenic rupture in case of fracture of the lower left ribs. So let's talk about the essential aspects, the very basic aspects of this organ. This is a soft, ovoid, reddish-purple, encapsulated organ consisting of both vascular and lymphoid tissue. And the location of the spleen is in the upper left quadrant of the abdominal cavity. The dimensions are that in the adults, this spleen is usually 12 centimeters long, 7 centimeters broad, and about 3 to 4 centimeters wide. And this roughly corresponds to the size of a fist. Whereas the average weight in the adult is 150 grams, and the range is 80 to 300 grams. So this is about 7 to 8 ounces. Remember that there are different factors which affect the size of the spleen as well as the weight of the spleen. One of these factors is the age of the person. Spleen is an organ which is more active in childhood, and it decreases in size and weight as a person grows older. Also, the sex of the individual has an effect on the size and weight of the spleen. It is slightly less in size and weight in women as compared to men. The nutritional status of the individual will also have an effect on the size and weight of this organ. Now, let's look at the surface anatomy. We should remember the area in which the region of the abdominal cavity in which the spleen is located is the left hypochondrium, under cover of the inferior part of the thoracic rib cage, just beneath the left half of the diaphragm. So it is related posteriorly with the left 9th, 10th, and 11th ribs. So these ribs numbered 9th, 10th, and 11th are present posterior to the spleen, and the long axis of the spleen lies within the plane of the left 10th rib. Also remember the lower or anterior pole of the spleen extends downwards as far as the mid-axillary line. And normally the spleen cannot be palpated on clinical examination. So let's look at these points which I just discussed. You can see over here, this is the spleen, and it is located beneath the left half of the thoracic rib cage. And let's look at its posterior relations. So the ribs numbered 9, 10, and 11. They are lying just posterior to the spleen. And also we can see that this here lower pole of the spleen is lying within the mid-axillary line. When we talk about the vertebral levels, keep in mind that at its most superior point, the spleen is lying next to the spinous process of the 9th thoracic vertebra. Whereas the lower pole, this is lying at the level of the first lumbar vertebra. Okay, what are the functions of this organ? Let's summarize the functions. One function is hematopoiesis, but this is a function which occurs prenatally or before birth. But after birth, there are different functions of the spleen, considering, first of all, it is a secondary lymphoid organ, which means it has an essential role in preparing and activating the lymphocytes for their role in immunity. Plus, it also filters blood. It destroys the damaged and old red blood cells and worn out platelets, and also recycles iron and heme. Now, this is another function, that is the storage of the red blood cells. So spleen acts as a blood reservoir. Now, this is a function which can be useful in case of bleeding, as it can release blood into the bloodstream. But this function is of more significance in other animals like dogs and horses, because in that case, there is more smooth muscle present within the capsule and trabeculi of the spleen. But in human beings, the amount of smooth muscle fibers is very limited within the capsule and trabeculae. So this function as a blood reservoir is of limited use during heavy or active bleeding. Despite all of these useful functions of spleen, the important thing you have to remember is that it is not a vital organ. This means that a human being can survive even in the absence of their spleen. Now let's discuss the gross appearance of spleen. We can remember this by keeping in mind the number 2. So spleen is an organ that has two surfaces. One is diaphragmatic and the other is visceral. Also, it has two borders. One is superior and the other is inferior. It has two poles, the anterior pole and the posterior pole. First, we shall discuss the surfaces. I told you there are two main surfaces. The diaphragmatic surface, remember, is the supralateral surface, and this is the surface of the spleen, which is smooth and convex. Whereas the visceral surface is the inferomedial surface. This is an irregular surface and it is marked by 4 impressions: the gastric, renal, pancreatic, and colic. So here is a dissected cadaver, and over here the left upper anterior abdominal and lower anterior thoracic walls have been removed. And you can see over here, number 2 is the diaphragm. It has been raised upwards to show us this here organ, which is the spleen. So if you just follow the laser pointer over here, we'll talk about its surfaces, which are visible over here in the dissected cadaver. So we can see over here, this here is the diaphragmatic surface, which I told you is the surface which is smooth and convex, and it is facing supralaterally. So this is the surface which is related to the abdominal part of the left dome of the diaphragm. So number 2 over here is the diaphragm, and number 3, this here is the diaphragmatic surface of the spleen. So here the left dome of the diaphragm separates the spleen from the basal pleura, the lower part of the left lobe of the lung, and also the 9th, 10th, and 11th left ribs, as well as this here costodiaphragmatic recess of the left side. So number 1 is the costodiaphragmatic recess, and you can see that it extends downwards till the inferior border of the spleen. So in this dissected cadaver, we can also look at the borders of the spleen. Number 8 is the superior border, which you can see is notched. Remember the notches which are present in the superior border of the spleen, they mark the splenic lobules, which were present before birth, but they had disappeared postnatally. And over here, number 6 is representing the inferior border of the spleen. And here is the lower or anterior pole of the spleen. And let's look over here. We can see this surface now is the visceral surface, and also known as the inferomedial surface. As I told you before, this surface is marked by 4 impressions. Now, the one which we can see over here is the gastric impression, which is facing anteromedially. It is a large, broad, concave impression on the visceral surface of the spleen, and it is lying adjacent to this here, number 9, which is the stomach. And it is the fundus, the upper part of the body of the stomach, and the upper greater curvature of the stomach, which is related to this here gastric impression of the spleen. And also remember, between the stomach and the spleen, there is a peritoneal recess limited by number 5, labeled over here, the gastrosplenic ligament. Okay. Also, we can see over here, number 7 is the left colic flexure, also known as the splenic flexure. Now, what about the other impressions on the visceral surface of the spleen? Well, if we want to look at the other impressions, here is now a spleen that has been dissected out for you. And you can see over here that this surface, which is facing us, is the visceral surface of the spleen. And over here, number 2 is the gastric impression, which we just talked about. Now let's look at this here impression, which is number 6, the renal impression. This is the impression on the visceral surface of the spleen, which is facing posteromedially. And it is related to the left kidney and in some cases also to the superior part of the left suprarenal gland. And also we can see number 1 over here is the colic impression, which is a small flat impression, and it is related to the left colic flexure as well as the phrenicocholic ligament. Between the colic impression and the lateral part of this hilum of the spleen is a small impression which is known as the pancreatic impression, and it contains the tail of the pancreas within the splenorenal ligament. This here is the hilum, and it contains these 2 ligaments, which I want you to observe over here. Number 3 is the gastrosplenic ligament, and number 8 is the splenorenal ligament. So the splenorenal ligament is also known as the lienorenal ligament. Okay. Now let's look at another diagram, a diagram of the spleen, which is showing us the visceral surface of the spleen. Let's look at these 4 impressions again. We can see the gastric impression, which is the large, broad, concave impression, which is present above this area, which is the hilum. Below the hilum, we have this renal impression, which is less broad and less concave. And over here anteriorly is the small flat impression, which is the colic impression. And then between the colic impression and hilum, we can see this here is the pancreatic impression. The spleen has been described as a wedge-shaped organ. So over here, I included a picture of a wedge. So you can see the comparison that the spleen, its shape roughly corresponds to the appearance of a wedge. Also, you can see the superior border, which is notched. And over here is the inferior border. And this is the lower pole or the anterior pole. And here you can see is the posterior pole or extremity of the spleen. Let's summarize the relations of the spleen. So posterolaterally, we have the left dome of the diaphragm separating the spleen from the left costodiaphragmatic recess, basal pleura, the lower lobe of the left lung, and 9th to 11th left ribs. Anteromedially are the stomach and the pancreas. Posteromedially is the left kidney and possibly the left suprarenal gland, whereas inferiorly are the left colic flexure and phrenicocholic ligament. So these are the relations of the spleen. I mentioned the hilum. Now let's talk a little about the hilum of the spleen. This is a longitudinal fissure present on the visceral surface between the gastric and renal impressions. This marks the entry as well as exit of the branches of the splenic artery, the tributaries of the splenic vein, nerves, and lymphatics. And when we come to the peritoneal reflections, remember that the visceral layer of peritoneum is surrounding all the surfaces of the spleen except the hilum. So the thing you've got to remember is that the 2 leaves of the greater omentum pass from the hilum of the spleen forwards to the greater curvature of the stomach as the gastrosplenic ligament. And they also pass from the hilum backwards to the front of the left kidney as the splenorenal ligament. So these are the 2 ligaments which are attached to the hilar region of the spleen. One is the gastrosplenic ligament and the other is the splenorenal ligament. Over here, I'm going to show you the greater omentum because we just mentioned that. The greater omentum, remember, it consists of 3 parts or 3 subdivisions. From the direction above downwards, these 3 parts are the gastrophrenic ligament, gastrosplenic ligament, and gastrocolic ligament. So these are the 3 subdivisions of the greater omentum. The gastrophrenic ligament is the one which passes from the uppermost area of greater curvature of stomach to the diaphragm. Then comes the gastrosplenic ligament, which passes from the greater curvature of stomach to the hilar region of the spleen, which I just talked about, that to the hilum of the spleen is attached this gastrosplenic ligament. Then the lowermost part of greater omentum is the gastrocolic part, which is known as gastrocolic ligament. And when we generally say greater omentum, we are often talking about this portion, which is the gastrocolic part of the greater omentum. But keep this in mind that based on the anatomy, we have three subdivisions of the greater omentum, which means gastrosplenic ligament and gastrophrenic ligament are also parts of the greater omentum. Coming back to the peritoneal reflections, remember that the layers of the gastrosplenic ligament, which are attached to the hilar region of the spleen, they contain the short gastric and the left gastroepiploic vessels. And between the layers of the splenorenal ligament lie the splenic vessels and the tail of the pancreas. So here is another diagram of the spleen, and we are looking at the visceral surface or the infromedial surface of the spleen. And here we can see these four impressions: the gastric impression, the renal impression, the colic impression, as well as the pancreatic impression. And here in the hilar region, we can see these ligaments, which are the gastrosplenic ligament. And we can also see this here, splenorenal ligament. And look at the branches of the splenic vessels, which are present between the layers of the splenorenal ligament. Okay, so now we will be looking at the surfaces of the spleen and the gross anatomy of the spleen on a digital model, so we can get a holistic view of this organ and develop a better concept. So here in front of you, I have a digital model of the spleen. Spleen is an organ which is having many important functions in the human body. Over here, we can see that it is a wedge-shaped organ, roughly corresponding to the size of a human fist. And this is consisting of basically two surfaces. Here, if you just follow the pointer, this is the surface which is smooth and it is convex. This is known as the diaphragmatic surface of the spleen. And it is facing supralaterally, so it's also known as the supralateral surface of the spleen. Now let's look at the other surface of the spleen, the one over here. This is the visceral surface of the spleen because this is facing the abdominal viscera. And it is also known as the infromedial surface of the spleen because of its direction, which is medially and inferiorly. These are the two main surfaces of the spleen. Also, we have two main borders. This here is the superior border of the spleen, which has many notches. The notches represent the splenic lobules, which are present before birth but disappear postnatally. And here is the inferior border of the spleen, you can see over here. So the next thing to keep in mind is that there are two poles or extremities. So this here is the posterior extremity or the posterior pole of the spleen. And here is the anterior pole or the anterior extremity of the spleen. Now let's look at the visceral surface in detail. The visceral surface has further a few impressions. This impression, which is the broad concave part, is known as the gastric impression, which is present above this area, which is the hilum of the spleen. You can see the hilum is the point where the branches and tributaries of the splenic vessels, their entrance and their exit is located. And below this hilar region, the less concave and less prominent impression is the renal impression of the spleen. Also, you can see over here, close to the anterior pole is the colic impression, the small flat area. This is the colic impression of the visceral surface of the spleen. Between the colic impression and the lateral part of the hilum, this here is the pancreatic impression of the spleen, which contains the tail of the pancreas within the splenorenal ligament. So these are the impressions of the spleen, and they are named on the basis of the viscera which are present close to that particular area. So where you have the gastric impression, remember it is lying adjacent to the upper part of the body, the fundus, and the upper greater curvature of the stomach. And where you have this here renal impression, it is lying adjacent to the anterior surface of the left kidney and sometimes also the left suprarenal gland. And where we have this colic impression, it is lying adjacent to the left colic flexure and the phrenicocholic ligament. And I already told you about the pancreatic impression, which is lying adjacent to the tail of the pancreas. So that here is the discussion on the gross anatomy of the spleen. So let's go back to our PowerPoint slides. Now let's discuss the blood supply of the spleen. So we are going to first talk about the arterial supply of the spleen. We know that is by the splenic artery. Now this splenic artery, which is supplying blood to the spleen, is, remember, a branch of the celiac trunk. And it has a tortuous course, which means it is coiled in its course and it passes posterior to the lesser sac or the omental bursa, but it is anterior to the left kidney and left suprarenal gland. So the tortuous course of the splenic artery allows for the distension of the stomach when it is filled with chyme. So remember, the splenic artery travels posterior to the upper border of the pancreas, and it runs in the splenorenal ligament posterior to the tail of the pancreas. And it breaks off into several segmental branches, which are about 4 or 5 in number at the hilum. And there's some other branches of the splenic artery as well, those branches which supply the pancreas, known as the pancreatic branches. And it also gives off the short gastric arteries as well as the left gastroepiploic arteries. So we can see over here, the splenic artery is right over here, present posterior to the upper border of the pancreas. And you can see it is a branch of this here celiac trunk. And this splenic artery, as it is going to the hilum of the spleen, it is also giving off these branches, which are the short gastric arteries, as well as the left gastroepiploic artery. Plus, it also gives off many pancreatic branches during its course. And you can see it is tortuous. That means it is, you can see, having a wavy course along its pathway. What about the venous drainage? That is by the splenic vein. The splenic vein is formed within the splenorenal ligament from 5 or 6 tributaries which join at the splenic hilum. And this runs posterior to the body and tail of the pancreas. It receives the inferior mesenteric vein along its course, and eventually it unites with superior mesenteric vein behind the neck of the pancreas to form the very important portal vein. So here we can look at this here splenic vein, which is present behind this lobulated organ, that is the pancreas. It has been formed by the union of the tributaries, that is the smaller vessels which arise from the hilum of the spleen. And you can see the splenic vein during its course, it is receiving the pancreatic veins as well as the short gastric and left gastroepiploic veins, and the inferior mesenteric vein as well. Behind the region of the neck of the pancreas, it unites with this superior mesenteric vein to form the portal vein. When we talk about the lymphatic drainage of the spleen, remember there are no afferent lymphatics, but there are efferent lymphatics, that is the lymphatics which are going to exit or leave the spleen. And they run posterior to the pancreas alongside the splenic vessels. Eventually, the lymph from the spleen is drained into the pancreatico-splenic and the celiac lymph nodes. So here in this diagram, you can see these bluish blobs over here are representing the pancreatico-splenic lymph nodes. they are receiving lymph from the spleen as well as the pancreas. And from these lymph nodes, this lymph then goes into the celiac lymph nodes, which are purplish in color, and they are present, you can see, around the celiac trunk. Now, what about the nerve supply of the spleen? Well, spleen is supplied by the splenic plexus, which consists of branches of the celiac plexus as well as the right vagus nerve. And these nerve fibers, remember, are mainly sympathetic and they're vasomotor, so they are involved with regulation of blood flow within the spleen. When we talk about the referred pain from the spleen, keep in mind that from the pulp of the spleen, the pain which is going to be referred to the central epigastrium, and this is going to be a vague or diffuse, poorly localized sort of pain. Whereas the distension of the capsule of the spleen can stretch parietal peritoneum. Now, in that case, because of the involvement of the somatic nerve supply, the pain will be pinpoint and localized, and it could be in the posterior left upper quadrant. Now, while we're talking about the spleen, let's go along mentioning the origin of the word spleen, because this has an interesting history related to it. You know, the word spleen comes from the Greek language, and the word is splen. Splen refers to milt. This is a word which is used for spleen in the animals, or lien, which I told you is a less commonly used word for spleen. But still, some textbooks use the word lien or lean. You can pronounce it as lean, which represents spleen. Now, in ancient medicine, you know, the spleen was thought to be a seat of melancholy and bad temper. So, you know, some person who might be saying, I wanted to vent my spleen. Well, this was used figuratively to describe a person who is ill-tempered or just wants to throw out their anger, and then they would say, I am venting my spleen. So that is a bit of the etymology related to this organ that we're talking about. Now, let's come to the clinicals of spleen. You must have heard about splenomegaly. We know that this term literally means an enlargement of the spleen. And there may be many causes of splenomegaly. It could be due to an immune response to infections. The infection might be viral, bacterial, or parasitic. Blood cell disorders such as hemolytic or granulocytic anemias can cause an enlargement of the spleen. Blood cell cancers like leukemias and lymphomas can also lead to splenomegaly. And also inflammatory diseases like systemic lupus erythematosus and rheumatoid arthritis. Metabolic disorders can also cause splenomegaly, and liver cirrhosis and hypertension is another cause of splenomegaly. So when we say splenomegaly, keep in mind that normally the spleen is not palpable in adults. But since I told you it is of a larger size in children, so in infants, the spleen is palpable, but it is not normally palpable in adults. If you recall the vertical dimension of spleen, I told you it is about 12 centimeters long. So when the spleen is 14 centimeters or larger, we call it splenomegaly. But it has to be about 3 times its normal size in order for it to be palpable at the left costal margin. In splenomegaly, remember the anterior pole, the diaphragmatic surface, and the notched superior border of the spleen become palpable below the left costal margin at the end of inspiration. And the direction of enlargement of spleen is downwards anteriorly and medially, because the left colic flexure and the phrenicocholic ligament prevent the direct downward enlargement of the organ. Usually, splenomegaly doesn't cause any signs or symptoms, but sometimes splenectomy is recommended depending on the cause. So splenectomy is the removal of the spleen. Let's talk about splenic trauma. Now, if we consider the anatomy of the spleen, we might think that this is an organ which is protected under the rib cage, but it is in fact more vulnerable to injury in comparison to the other abdominal organs. Now, there are multiple reasons behind that. One of those reasons is that it is a mobile organ. You know, it has two ligaments, the gastrosplenic and splenorenal ligaments. Also, although it is present beneath the left side of the thoracic rib cage, but that also makes it vulnerable to injury by a rib fracture. Plus, this organ is having a very delicate fibroelastic capsule, just about 1.5 millimeters thick. This also makes it fragile and exposed and vulnerable to injury. There could be many causes of trauma to the spleen, such as I told you, if there is a fracture of the rib, that can cause a laceration of the spleen. The spleen can burst due to blunt trauma in road traffic accidents. Also, sharp penetrating injuries in the lower left thoracic region can cause injury to the spleen. And this can lead to intraperitoneal bleeding and a lower blood pressure, that is shock, which could be life-threatening. Extensive burst injuries or major injuries to the hilar vessels usually require a splenectomy. So let's talk about splenectomy now. I told you it is the surgical removal of the spleen, and splenectomy can be partial or it can be total. Partial splenectomy, remember, is followed by rapid regeneration of the lost tissue without any significant loss of functions of the spleen. So this organ has a regenerative capacity. But what if we need to remove the whole of the spleen, that is total splenectomy? Well, this involves cutting the two ligaments of the spleen, namely the gastrosplenic and splenorenal ligaments. And while removing the spleen, we have to be careful not to damage the tail of the pancreas and the left colic flexure while we are ligating the splenic vessels. After the spleen has been removed, the hematological consequences are very limited since the function of the spleen is largely replaced by the liver. A person might be at an increased risk to certain types of infections, especially the infections caused by encapsulated bacteria. If the spleen has been removed in childhood, a condition can occur which is known as the post-splenectomy sepsis syndrome. It can also occur after removal of spleen in the adults, but it is more likely to occur in children. In adults, the splenectomy is usually followed by a temporary rise in the WBCs and platelets, but this is also recovered within a few weeks. What is segmental resection of the spleen? As I told you, the splenic vessels, they divide into several branches at the hilum of the spleen. So when we're talking about the branches of the splenic artery, that is the segmental arteries, remember they supply each segment of the splenic tissue. But there is little arterial collateral circulation between the segments. Therefore, occlusion of a segmental vessel can lead to infarction, that is the loss of function or death of a part of the spleen. So the resection of one segment is still not possible, even though there are no arterial collateral circulations between the splenic arteries branches. The reason is that there is collateral venous circulation between the tributaries of the splenic vein of the segments. So that is why segmental resection of the spleen is practically impossible. In the last, I would like to discuss the accessory spleen. So it is a normal anatomical variant. There might be an extra spleen, but this is normally asymptomatic. Smaller splenic tissues, they are known as splenomegaly. They are less than 2 centimeters in size, and they're usually just about 1 or 2 in number, lying close to the hilum of the spleen within the tail of the pancreas. They can also be present in the gastrosplenic ligament or infracolic compartment. Like I told you, they're asymptomatic. Their clinical importance is at the time of splenectomy, in which case we have to remove the accessory spleen along with the main spleen to avoid the recurrence of disease symptoms. So now that we've ended the discussion on the gross anatomy of spleen, I'm sure you'll be able to answer these MCQs. The largest lymphatic organ in the human body is the spleen that you have to keep in mind. Now, here is a clinical scenario. There is a patient who complains of severe abdominal pain on several occasions, but no cause could be identified. She has been recently diagnosed with polyarthritis nodosa, so an abdominal arteriogram is ordered to determine whether there are abdominal vascular changes that would explain her abdominal pain. So here in front of us, we are looking at an abdominal arteriogram. This gives us a picture of the arteries within the abdominal cavity. And here we can see the arrow is pointing towards a large, tortuous, large diameter vessel. Now, which one is this vessel? We know that this is the splenic artery. Now, which of the following anatomical structures is positioned medial and anterior to the splenic hilum? The answer to this would be the fundus of the stomach. Let's look at these distractors and why they cannot be right. You know the diaphragm is located superolaterally to the spleen, so this cannot be the correct answer to this MCQ. The left colic flexure is located inferior to the spleen. The left kidney is positioned medial, but its position is posteromedial. The fundus of the stomach, it is related anteromedially to the spleen, so this D is the correct answer. Phrenicocholic ligament cannot be the correct answer since it is located inferior to the spleen. So this concludes with today's discussion on the gross anatomy of the spleen. And I hope I covered all the basic aspects, and we discussed the clinical aspects also. We talked about the functions of the spleen as well. And we also discussed it on a three-dimensional model so you could have a better conceptualization regarding this organ, which, remember, is an important organ. It has many important functions, but it is not a vital organ. Human beings can survive without their spleen, but the consequences, we discussed those consequences which could take place. Thank you for your time, and I'll be coming soon with another topic. Till then, take care, enjoy your studies. Goodbye.